Dr. Himani is PGY2 in, she is a dedicated surgical resident with a robust academic and research background. She is from Himalayan Institute of Medical Sciences, Uttarakhand. She pursued her one-year research fellowship at Mayo Clinic in Minnesota, and she's very passionate about surgery. She decided to take USMLE and then completed her surgical electives in USA. Now she is PGY2 as general surgery resident in Memorial Hospital in South Florida, and she continues to build her expertise and commitment to the field. She is hailing from the foothills of Himalayas, and her journey has been very challenging and rewarding. So we are very honored to have with us Dr. Himani, and over to you, Dr. Himani.
Hi, everyone. I'm Himani. Thank you for the welcome. I've been in touch with Dr. Manchuri for a while. He has been kind to offer help at times when you apply and stuff. So I'm really grateful to be here. I am a PGY2, currently just became a PGY2 in general surgery. So yeah, I'm open to any questions or any thing in the session that you have for me. Sure. Right. So, as of my background, I hail from Uttarakhand, the city called Dehradun. I did my medical school there. During my medical school, I was deciding about USMLE, was kind of unsure because I knew that I wanted to do general surgery, or any surgical branch. Initially, I was interested in neurosurgery and a multiple of surgical specialties. And I knew it's really hard to match surgical specialties here in the US. So it was not like a dedicated study or anything that I did. During my internship, I saw people coming here for electives, and I had friends who guided me how to apply for VSATs and other things. So I was the first person from my medical school to even get the license for VSATs and everything. So I worked my way through that, did my electives here. During those electives, I realized that yes, this is the journey that I eventually want for me. I came back, I studied for my step. It was really hard, it was challenging. It didn't come really intuitively, the MCQs and everything, or the USMLE journey. I mean, the education was nice, but I would still struggle with my scores and stuff. So it was a long, hard journey. I got through my steps. I had a good support of my family. I think that's really important throughout to mention. I think the first and the foremost is they let me be at home, work for some hours or whatever it was, and then just be preparing for an exam. Because once you graduate or you're in your internship, it's really hard for you yourself and your family to be like, are you just gonna sit here and not actually work and hold your life for this exam? And then you'll be like, yeah, this is what I see myself doing. And then you also, I come from a non-medical background, you have to explain it to them that there are very high chances that I may not get through. Because I was really stringent on getting surgery. Did my exams, and then after my exams, I applied for research fellowship because when I came here, I realized the importance of research. I didn't have a robust or extensive or any research experience in my medical school. It was one or two articles, but I didn't even know how to make a poster or present a poster and how easy it is. I just didn't have that kind of exposure. So I did my research fellowship at Mayo Clinic. I joined as a research trainee and then became a fellow. I think that was one of the breaking points in my journey because I learned too much in that short period of span. Research is not something that you can build in 1 month, 6 months, or a year. But I think if you show dedication and if you are really hardworking, it might seem like, how do you work hard in research? Well, you can work hard in any of the branches or any of the subspecialties or any pathways in surgery or medicine. I would work late overnight and everything. And I think that I was working with multiple people And I connected with all the surgeons in my department at Mayo Clinic. I think that gave me insights, and because they've been dealing with IMGs, they knew how the system goes, so they were able to like give me advice. They would help me through the match process. They would like review my they would mock interview with me. They would read my like not my LOAs, the personal statement, like they edited. They would like suggest things to me. So I think that is what was really important for me coming from that like big of a place. I think it gave me an edge. Being on visa is definitely hard, but you navigate your way through. I didn't get a lot of categorical interviews. I was still looking at a prelim position. People ask me this one question is a lot like, how do you prepare yourself to be a categorical position holder or whatever it is? Like nobody knows that. Like I will tell anyone and everyone, even my best friends, the same thing. Nobody knows that, what it takes to be applying for that or getting a categorical position. I certainly feel like people who were smarter, had higher scores, more research than me, matched in prelim positions. It's just how the system here in the US works. It's nothing related to you. It's just you have to connect or pave your path in a direction to get surgery. Prelims do turn over into categorical positions. It's a lower rate, it's stressful. I'm lucky to be here, but I honestly don't think so that there is a difference that you yourself can make. I think you should put in an honest effort. People think getting a prelim surgery is an easy thing. Well, no, giving a USMLE step one, step two, it's not an easy thing. Publishing one research article is not an easy thing. So wherever in life you are, it's not easy. It takes effort, constant effort from you, your family, your friends, and people who support you and your mentors. So I think at the end of it, you just embrace what you get, and then you decide whether or not you want surgery that bad that you would, because getting being a prelim is harder. So if you want to make your way through being a prelim to a categorical position, and if you want to work that hard for a field, or you just want to get into medicine in which you will get a direct categorical position or like other branches. So there are like even harder branches like ENT or like DOM, and IMGs are like getting through all these positions now. So it's just, I think, like a lot of hard work that goes in.
That was a very valuable answer. Thank you so much. So we will definitely address the questions in the chat box, but we would like to know that what does like a typical day look like for you being a surgical resident?
Okay. Being a surgical as an intern, I would say, because I'm like a fresh new PGY2, so I'll talk about being an intern. I think you would go early in the morning. I'll just talk about my general surgery rotation, I think, because that's like a general surgery residency. In my gen surge rotation, depending on the list and what time we would round, I think we would round around like 6 every morning with my seniors. So by that time, most of the times, like you would pre-round on patients and make your patient list, which would range like depending on how many patients you would be at the hospital between like 4:30 to 5. You would pre-round, you would make your list, and then you would run the list with your senior, possibly go see most of the patients with your senior, and then the attending would round around like 7-ish. And then you would like sit down and jot down all the notes in the EMR. And if you're done early, you would go to the OR. There were days in which you couldn't go to the OR because your notes would not be done, or what's like, things come up. um, so I had like really kind seniors. If it's an intern appropriate case, my seniors would be like, I will work on the notes, and they would like let me go to the OR, which is the rarest thing which I've seen in surgical residency. I think my program's really nice, and I had like great seniors who would do that for me. So you would do that. And then in between the cases, like, because by that time, like if you're like in the middle of residency or like intern year, you become a little efficient. You're able to finish things sooner. So if you're able to finish your like floor things sooner, then you go to the OR, do whatever post-op notes you can. And then in the middle of the cases, you would go and do like INDs or like wound care for the patients on the floor. And then just end of the day, like you would sign out to whoever it was. If like the day can go on from like until like 4 p.m. to like 11 p.m. or the whole night. It depends on how many cases the surgeon's doing or what's ongoing. This was during the day. And then you would have your night shifts in which you would have like 12-hour night shifts we did weekly basis after every couple of weeks. In that you would just see, and in that it was pretty interesting because we were holding like four services down. So colorectal surgery, surgical oncology, general surgery, and vascular surgery at night. And you would be the only surgical person in the entire hospital. So it was like really challenging because once you would get a vascular surgery, like possibly an acute limb ischemia or like a compartment syndrome, and then you would shift to like peritonitis or whatsoever. So I think being that person at night was really interesting. But this is how like most of the days go. On vascular surgery, we did have home call. So every other day, you would be on call, which really sucks. But it just gives you a lot of opportunity. So vascular surgery did start like really early in the day. And then it would go even longer because the cases are longer. There are multiple cases and the acuity is higher. Patients would come at like 9, 10 p.m. and like ED would call you with like pulseless limb or whatever. So you have to rule out acute limb ischemia. So you had to go in multiple times over the night. So that's how usually the day goes. It's less than 80 hours a week, but you still have to do like presentations, conferences, research, and a bunch of things, which like takes up a lot of time. So it's busy.
But yeah, it definitely is a very dynamic schedule. You're always working. Now that step one has become pass fail, do you personally feel that the value of research has increased than before?
I think value of research here in the US was always higher. Um, Step one, becoming pass fail, yes. Because see, it's very logical. They're going to make step three apparently pass fail now. It's very logical, I'll tell you. There are like 100 people who are going to apply. Okay. Residency programs are going to take 10. They need some metric to take people. Okay. Some metric. If everyone's clearing step one, how they have not known you as a person until unless you've rotated at that program. Okay. And being an IMG, you are at disadvantage because you go to specific programs. And if those programs are giving visas, that means that a lot of IMGs are going there, right? So you are like concentrated in that region. So other people, and even if that person gives you an LOR, that same, even if you did a great job, like out of 100, 80 will do a great job because they're applying for surgery. Like surgery residents or like people who apply for surgery, they're very hardworking. They know what they're putting their lives into, right? They know what their future is going to be. So they're very hardworking. So out of those 100 cohort that's going to apply, 80 is going to be like super hardworking. So you're already comparing yourself amongst like really hard workers. So if you go and like rotate with that, like if 50 people rotate with the same place that is giving visas and that IMGs are going to, the LOR is gonna kind of look the same, right? And that LOR, like kind of looking the same LOR is gonna like fly out different places, right? So how do you compare? They are getting like an equivocal LOR from a US surgeon until unless you're like extremely intelligent and you have like 100 publications, then it's a different story, right? But how do you like differentiate, right? Then NRMP gives you like how many research articles that the people applying have, right? So you can see it's always good to be in the higher end, You cannot be in the bell curve. You cannot be, because you will get lost in the cohort. So yes, the step one pass fail does have impact. I mean, Dr. Conrad Fisher like talks freely about it. He's like, it's a disadvantage to IMGs if you make things pass fail, right? But people have different metrics here. I've heard people say here that IMGs have to score higher than the AMGs is because they dedicatedly study for this exam. But they don't understand is that they dedicatedly study for this exam does not make it easier. The exam itself is so harder that it's not easy to get like 270s, 280s, or whatever people are getting, right? It's not. And then people give their so many years and like months and like what not to study for the exam. I think it just puts like them in a bad position. So what I feel is you should study for the exam, give the exam, get an above average score, yes, just to clear the filters out. But you have to do something to stand out. Either you rotate at the program that you think you might have a connection at, or you might have chances at, or publish. Like, what else is there in your hand to like stand out? It's like unsaid. Maybe like everyone's getting like 100 publications in like 5 years. Are people going to be like, you have to publish 100 articles before you apply? It'll take like 5 years to do that. Somebody who started in undergrad, you cannot compete with them if you started like 1 year. Like, how many years are you going to give to it? So it's just like make the best out of it. Come to conferences here. I think that's one thing that people don't emphasize a lot on networking. When you come to conferences, you have to go and speak with people, get their insight, and connect with people because a human connection is needed. No program director is just going to sit in his position and be like, this person looks okay. Let me just hire this person. That's not going to happen until unless like the program is struggling to get people or is getting unmatched a lot. Other than that, I think they have plenty of applications to weed out people.
Okay, thank you. That was really helpful because students really struggle with what to do now that step one has passed fail. The metric system has decreased, as you said. So, since general surgery is a competitive specialty, I'm sure there were people who would have told you that, it's next to impossible or it's very, very difficult. So, if yes, so how did you fight through that negativity?
I told them I'm applying for family medicine. I am very honest about it. I didn't tell anyone I'm applying for surgery. They would say you're a female, you have like average scores, you're new to research, I didn't have research background. I don't have any connections here in the US. I don't come from a medical background. And people would straight up tell me, you're like being stupid. Like, why would you do this to yourself? And I would tell them, okay, then I'm gonna apply for family medicine. And I didn't care about people. Like for me, like I knew what I wanted to do, but I also knew people match in surgery. Like I knew this guy from India who matched in prelim surgery and then went to categorical. And when I was in Mayo, I saw people uh, people who matched here in the US. So I was like, it can be done. So that's why I think I promote a lot matching into surgery is maybe most of the people don't see that. But even if like I'm able to like show one person that yes, if you put in an effort, like it takes a lot of constant effort, a lot of tears, a lot of hard work, a lot of sleepless nights. But if you put in an effort, there might be, I mean, it's not 100%, right? But there might be light at the end of the road. That is something I think gave me hope. And I think that is the only reason that I made my Instagram page or whatever it was, just to show that yes, it can be done. Okay. It takes hard work. And then people ask me, do you think it's doable? Should I apply for medicine or should I apply for surgery? And I'm like, if you are thinking of that question, then you should not be applying for surgery because it's a very, very demanding and hard branch. I have never thought about quitting when I was applying. I knew if I don't get surgery here, I'm going to go back home to India, which is a great place to practice medicine also, and I'm going to be a surgeon there. But I never thought about that, okay, I'm going to be like an internal medicine or an anesthesiologist or anything here in the US. That was on my plan anytime. And I was pretty certain about it. So, and since I've joined residency, I've thought about quitting multiple times because it's hard. It's really, really, really hard. So, if you have thoughts about doing something else, you should. Surgery has the highest attrition rate. If you think you're not meant for it, if you think that, other things are important in life, then you should make a wise decision for you and your patients. So, yeah.
That's really inspiring. I love that you're so strong about what you knew what you wanted. And with us IMG especially, there are a lot of people who what we call have red flags, be it two attempts on steps or more like year of graduation more than five or something like that. So can you address like those section of people?
So I didn't have any of those. I think, I mean, that's the honest truth. Like having those red flags just puts you in a bad position, right? This is a day and age of competitiveness. The population's like bursting. I mean, they do have seats, right? But they go unmatched. Do you see the amount of prelim positions that go unmatched? And like the category, like surgical categorical doesn't go unmatched, but they're like EM was like unmatched and stuff, right? Like, so you have to make yourself that the programs pick you, right? You have to have that. Now, if you are in a position that you fail step one, then you have to compensate. Then you have to suck it up and compensate. Then you cannot like see, okay, I failed step one once, but then you do a stellar job in step two. You cannot be like, I like, did a bad job in step one, I did a bad job in step two. You do a great job in step three. Okay. Or you publish like 500 articles and then you apply for a branch like surgical branch, it's hard, okay? Because I'll tell you why surgical branch it's hard. And I struggle with it because coming into surgery, they expect you to know all of medicine day one. And surgery, you have to learn starting from day one, and in which they expect you to things. If they're taking people who are not doing great in their exams, how will they juggle knowing medicine? Okay. Learning surgery and then also giving the in training exams. Like how? And every program is judged by their American Board of Surgery passing rates, right? An American Board of Surgery passing rate research shows that if you have failed step one and step two, you're at a higher chance of failing American Board of Surgery. So if I have five chief residents last year, if one of them fail, your program's already at 80% pass rate, right? Two people fail, it's at 60. So, just the metric goes down like really fast. Okay. So the program's just not going to pick you. And it's not because they're being like, oh, we gave step one, so you cannot. It's just how they are judged and it's how they're compensated. It's like financial constraints in there. The program gets paid by these metrics. So it's not just because you did whatever, so put in your best effort, but if not, surgery is hard. But then you have to maybe like come do research, make your own connections. Is it certain? Getting surgery or getting residency, even internal medicine or anything, is not certain ever. You just put in an effort and pray for the best. So for these people, I think, who have like failed whatever, if you have a next exam coming up, do a stellar job in that. If not, then do research, present it at conferences, connect. I think that's it.
So try to make up in other aspects of your application.
Yeah.
Okay. We'll address some questions from the audience. We have a lot of questions in the chat box. So, according to you, what things matter most to the PDs of general surgery in the ERAS application?
I think everything. I mean, ERAS application, everything matters in ERAS application because your personal statement matters. So programs will tell you how many years out you have to be from graduation and stuff. You have to be around like 2 years out from graduation. The same was for me. So I was 2.5 years out of my graduation, but that worked out fine. So it was a 2 years or like a 5 year cutoff. I think most of the programs say 5 years cutoff since graduation. Try to do everything in that time frame, and then scores, and then research articles, volunteer work, everything matters. Awards and honors. So what you can do is like you can go online and see what the ERAS application holds, and it's everything and technical aspects like research and statistics, and then they want to know if you're good at statistics, you are just at a higher level. And actually, like people who fail any of the steps or they have attempts on that, I think getting an MPH and getting statistics under their arm can be really benefit, because every hospital struggles or every surgeon or a doctor struggles with their research is because the limiting rate in that thing is a statistician, and it's expensive, it's rate limiting, and you have to explain what you want to do. So if you can do your own statistics, your research is going to come like super quick. So I think getting that done can be really beneficial.
Thank you. A lot of us want to know in depth about your research position. So we have someone asking, how did you draft emails and how did you get into the research position? How many publications did you get from that? So a lot of questions are about your research position. So can you talk about that?
Sure. Okay. So I had a friend go to Mayo Clinic to do research. So he told me to apply for Mayo Clinic research. So I didn't know anyone at Mayo Clinic. He didn't know surgical people at Mayo Clinic. So I just went to Google. I typed Mayo Clinic surgical programs, and then tried to find all the emails. And Google, you can find anything and everything. So I found those emails. I sent emails every day. I would send, I started with like 10 emails a day. And then my friend was like, people are sending 200 emails a day. What are you even doing? Like, just send more emails and everything. So I would send around like, I think 50 emails a day, because you just don't have to send the emails. Okay. So I didn't write any of the emails. I got a template from my friends. We're doing all of this, which is nothing but like, hi, I'm Himani Bhatt. I'm a graduate from this and this year. And I did my step one, step two. This is the score. And then I'm interested in research. I came to do electives there. Got interested in research. I've been looking into your research. These are the articles I got interested in. Do you think you can offer me a position? Or I would really love to collaborate with you. You just like, and now there's AI. Do not copy paste. AI is a friend, but it can be an enemy if you copy paste from AI. So, use it more intelligently. Um, so I think you can like formulate your emails through that and everything. What else? I think just send those emails out and then pray for the best. So I think I sent anyway. So I did Mayo Clinic, I did Stanford, I did Harvard, I did Hopkins. I sent, I think, anywhere around like 700 emails, and I was the lucky ones who got it sooner. My friend said you're gonna apply to like at least 2,000, like 3,000 emails you're gonna send out, and then nobody replies back. Okay, people ask me, I've been applying, nobody's replying back. But you don't need everyone to reply back. You need one email to give you the position. Just remember that. So it's going to be 0.001%, but that's what you're fighting for. Okay, so they don't apply, like reply. That's fine. Keep applying. Somebody's gonna have a position. I work here now, and I know for a fact they need people in research. You just have to find the person at the right time who needs that person. For that, you have to broadly email. And people keep asking me, how do I find it? How do I find emails? How do I do this? Google. And if you cannot find a certain doctor in the emails, fine, move on to the other one. Like, like it's okay. Just go to a page, find like go to colorectal surgery, go to like surgical oncology, find a doctor, email. Next doctor, email. Next doctor, email. Like that's how you move on. And then you see like whatever branch, if you're interested in being an IMG, I think you're at a disadvantage of actually getting research in the branch. And people say, I'm not getting a surgical research. Should I get an internal medicine research? Yes. Take whatever you can. Okay, I say beggars are not choosers. Okay, it's in a mean way, but I think have low expectations and then pave your path through it, get into internal medicine, make connections with the surgery people. But remember, be honest. Tell the person you're going to do research with, hi, I want to do surgical research. I am not getting one. I would love to collaborate with you, but I would like to transition to surgical research. Or do you think you have any topic in your mind to start a project with me in like collaboration with the surgical topic? You have to be honest with people. I mean, that is a given. If you are working with your PI, principal investigator, the research person who's like getting the visa work and like whatever for you, and you go there, be like, oh, I'm going to do medicine, and then in 2 months, I'm going to find a surgical position. I'm going to say bye. That don't do that. Okay. Good things don't fly out quicker. Bad things fly out really quick. And that is not somebody you should be. So I've seen people do that. Please do not do that. um just be honest, and people respect that. Okay, people also know that you're trying to get your foot in the door. People also know that you want to come and like work, and you're working for free. Most of the research positions are going to be for free, so you're coming here working for free. If they are making you work for free, then you have to get something back, right? It's not a selfless thing. They know what you're trying to do. They know you're trying to get in residency. If you're vocal and honest and hardworking about it, people will understand. People will help you. People will say, oh yeah, I had this person 2 years ago who did the same thing, and like they came work with me for a year, and then they were able to connect to this person, and then they did surgical research with them. And they have to see you for 1 year work for them to recommend you to that surgeon. And that's the path you choose.
Um,
And how many
and
research articles I had. Yeah. So sorry. So I don't remember. I think so there were like published were I think less than 10. Unpublished poster presentation and everything, I think including was like I think 25 to 30 in total. And then I had book chapters. I had like a bunch of things. I went to Mayo Clinic and I told them I'm gonna apply in 6 months. So people don't like that. But I was like, I might go unmatched and I'm fine with it. And my PI, the nicest person on the planet, she said, okay, if you want to do that, we will support you. So she wouldn't offer book chapters or anyone to anyone else. And she would come to me, Himani, do you want to do this? And I was like, yes. A person who doesn't even like reading book chapters had to write a book chapter. So, I mean, I stayed up at night. I found people to help me. I found things. I found everything that I had to do. And then still I did whatever I could. And then I sailed through that, right? In a couple of months, I was able to publish things. So I think again, being honest in that position helped me. But I think in total, I had like a big 25 to 30 articles overall, including everything like posters, publications, unpublished, or like in press articles. So yeah. And for residency, everything matters. Everything counts as like one.
looks like you had a very nice experience there. So there's someone asking that should I go for general surgery match directly after my graduation in India or after home country residency in surgery? Which one will have more chances of getting matched into categorical?
Um, I don't have a surgical residency from back home. I think if you want to come here, there's no point doing surgical residency back home. You're taking one. So that's what my brother says. Like, you're taking one doctor away from India. You're wasting surgical residency of India, one, which is bad. Okay. Somebody else could have taken your position and somebody else could have done surgery residency. And people ask me, why didn't you do surgery residency? And I give this answer to everyone that I didn't want to waste the position. They graduated me, yes, but then I didn't waste a residency position there. Okay. After I did my medical school, I decided that I'm going to practice here. Doing it twice, I don't think so. I don't think so it's nice. I don't think so it's good, fair for the country. I don't think so it's fair for anyone. That's a moral, ethical reason. I'm sorry about that. Doing residency there and coming here will change nothing, will put you 3 years out of graduation, which is bad. Okay. So applying directly, they want fresh graduates. They don't want people who are going to be like, day one, I'm a surgeon. I'm going to go and do an abdominal hernia case or like a peritonitis case. They don't want that. They want people who are nice and who want to learn. Okay. So I think both are acceptable. Maybe you decide after your residency that you want to do like residency here in the US, which is acceptable if you didn't make a plan. But if you're a graduate thinking that should I go this route, double residency, I don't think so it makes any sense. Why would, for me, my family was like, just do residency here, don't sit at home or don't like just do a job, just take residency. I did clear NEET. They were like, just take it and everyone will live happily. And I was like, why should I go through the torture of residency twice? Like, I just don't want to go through that. So my reason was moral, ethical reason, and then I just didn't want to do residency twice.
Okay. Um, and where did you do your electives? I think besides the research position, they want to know how did you approach those electives?
Yeah, mine were at FIU, UAB, and UIC. And I did a sub-I after graduating in South Texas Health System. I did it there.
Wow. And did you approach the attending or through applications, official applications?
No, I think that has changed since the time I did it. I think I did it through visas. That time I just started the application for my program, but I didn't. I think just UIC was through visas. No, the UAB was through visas, and the others, I think they would have like a running list at that time, and people were like, "These are like 10 places which will give you a elective." Like on Facebook or something. I think I just used that and like randomly applied. One of them was Mount Sinai. It was $1,000 application fee that I paid and everything. But then the time that I requested, I didn't get that. So I got wasted also. Um, I mean, that was easy to get that time because it was $1,000 application, of course. So these were the places I did it, and it was through the portal on their like the hospital websites, and their program coordinator had like a application and everything that you had to fill out and you had to pay them to apply. Like I think it was all electronic. I did have my brother here. I think he paid electronically through the US card. I think that is another thing that people struggle with. So you just have to find people who would do that for you. I know it's hard, but I think now things have changed a lot. So they would have like found ways to get that done. So yeah, I think I'd applied like on like paper and stuff and like sent the complete PDF to the coordinators and just one through visas.
And then in your ERA CV, do you remember what were your 10 experiences? I'm sure I don't think there were 10 experiences at that time. I think they've changed, but do you remember the major experiences?
No, I don't. Did I have 10 experiences? I don't remember I had 10 experiences. I think that was a thing started last year, maybe.
Recently, yeah.
Yeah, 10 experiences. I mean, I think there would be a better person to answer that question, but I think it would be holistic. I would stick to 8 of them being medicine. Like helping rural population should definitely be one, or like whatever like projects you did to, because in India, like no matter where you practice, you will find something you did for the rural population, like um community medicine that we have, right? PSM, preventive social medicine, we have like some projects. India, I think like for graduation is mandatory to do that, right? So I think like quote like couple of things you did for them, your internship, if you like practiced in like I practiced in like the district hospital, situations were like really bad there, so how did you deal with that and stuff? I would do that, and like COVID drives or something if you guys did.
Okay. So if there is a medical student, I think, who wants to know that any advice you can give if as a medical student I'm interested in pursuing surgery.
Yeah, I think Indian system runs a little differently than the US systems. don't emphasize on steps until year 3 or year 4, but then being a final year medical student and then giving steps can also be hard. But I've seen people do it and they did great. Okay, if you're able to do that. I studied for it a little bit and then I was like, no, no, no. I'm like struggling to finish my college work and also give steps. But a lot of people were able to do that. Okay. So if you're in that category, you do that. I wasn't. Um, what more important is build your basics up, do research. Back home in India, you have ICMR projects, you have like different bunch of things, poster presentations. You might think it's in India, it doesn't matter, it does matter. And people from India come present here at the American conferences also. But then it has a financial aspect. It's really expensive and it's, whatever. So that's not important if you're not there. Presenting in Indian conferences is good. Starting like being eccentric in your application. It's a weird thing to say, but I think it's nice because being what did you do in your community that sets you apart? Like, start some project or something to do something for your community that just gets you like name, fame, and like, something good for the community that can be spoken about. Get distinctions in your subjects. I think like honors and everything they really respect. Find people who are in the US, like try to collaborate in research with them. um it's just hard, but like I can't do like case reports and other thing, but I can do systematic reviews and learn statistics when you're like a medical student, like be really good at it. And like because that people don't understand how big of a selling point statistics can be. It's really undervalued. And I'm gonna try and do my statistics something, but it's just hard to find time about that. But do that, I think, yeah.
Okay, I think statistics is a very big takeaway from your answer.
If
Um,
you're like trying to go for surgery, for sure, like for sure, sure. Like I think statistics research, that's a rate limiting step. If you have time as a medical student, yeah, I think you can definitely do it. So because research, because step one's pass fail, step three is gonna become pass fail. Step two, everyone's getting 260s. No, okay, not everyone's getting 260. People are getting higher scores. Okay, let's put it at that. But 240 above and everything, everyone's getting it. How do you differentiate yourself, right? And in the CV, you put like statistical software, your CV just increases in number. So it's nicer.
do you have any advice on the ideal timeline? Like, what's the best time to give steps? What's the best time to, start applying for electives and prepare your CV, and a very ideal timeline for someone who has just started?
I think that question is so different because people decide about USMLE at so many different stages. People have financial constraints, people have family constraints, people have whatnot, right? And ideal would be what? Like a medical student who did his steps, step one maybe in the final year, in internship, came here and in internship in the beginning of internship, within like few months gave his step two, and then came here for electives during the internship, and then apply the same cycle and match the same cycle. Sounds impossible. I've seen people do that. Okay. And then during the medical school, also have research. But I mean, you will lose a lot, right? Like doing all of that. But people do it. Yes, people do it, right? If you're motivated, yes, you will do it. But I think you just for a surgical application, what I feel, there are like certain checks boxes, right? Like you have scores, research, volunteer work, what else? Like early graduation and everything. Like just don't have any of the check boxes like unclicked, you know? Okay, you're like out of graduations are fine, like that's not under your control. Like do everything. Like everything you can do, no matter what stage you are, but just stay dedicated. Like if you're focused, you get it. Yeah.
I think they want to know about your personal like MBBS batch and when did you give steps and like that so they can compare with their timeline.
So I graduated in 2019, did my so during my internship, I was preparing for my step one, and at the same time when I was preparing, I applied for my electives. At the beginning of my internship, applications took me a month because the applications were like getting like visa certification, everything. It was really hard because I had to get like certification for my hospital. So did all of that. It took, I think, a month or something, applied for that, starting studying for my step one. Um, Before my electives, I wanted to give my step one. I got a score of I got a score of 160 on my NBMEs. Didn't pass, failed terribly. And I was like, I'm not gonna go for my electives. Um, and my mom was like, just see, go there and work and be sure that you actually want to do it or not. And I was like, no, I'm just gonna give up on USMLE and everything. I think my mom was like, if she told me, I'll quote it. She said, if at the first failure I gave up on things in my life, I would not be here where I'm at today. And I was like, damn. And I was like, fine, I'll go. So I came here, I did my electives, and I was more motivated to do that. Then I went back, I started studying. I took like a hiatus. I was here for 6 months and then took a hiatus for I think like 6 more months or something. And I was preparing for my step, but then COVID hit. That sucked. Like this test centers, everything shut down and everything. So it took me a while, but I think in March of 2021, I took my step one, and October of 2021, I took my step two, and December, and then I started applying for research and stuff. And December is when I came here for vacation to live with my brother for a while. And then I did 2 months of pediatric surgery research with a surgeon in Texas. And then I did a sub-I in orthopedic surgery because I just needed some fresh surgical experience. So I did that, and then I got my research at Mayo Clinic. I was doing remote research with the UAB. I was also doing remote research with people in New York, or Houston. So I had like three research positions at one time, and that's how I was able to build my research CV so much in a short span of time. And I told my Mayo PI who sponsored my visa and everything that, listen, I have these jobs or like research positions, but I'm gonna work for them also. But you are my priority. Your work will never suffer because of me. And she was like, yeah, I understand you're an IMG. I understand you're trying to pave your path and you do whatever you want to, we'll be supportive. And she said, thanks for being honest. And I was like, okay. So that was my timeline. And then that cycle I matched.
You had a lot of meaningful experiences. So there's someone who wants to know, would it be wise to go for integrated surgical programs, like say plastic thoracic surgery, given their poor match rates for IMGs, or stick to conventional 5+2 general surgery pathway?
I think the next speaker you have is the NT. So, I mean that speaks a lot. Okay. So surgical, I mean, if you're asking that question, if it's a specialty that you want to go in other than plastics, now plastics is or vascular surgery, these are the two specialties that you can go after doing gen surge. But plastics is becoming just integrated now. So plastics, I think my senior applied, she matched in plastic surgery last year. She just started her fellowship July 1st, actually. She's gonna start it July 1st. She's told me I think there are like 30 or 40 programs which are giving like integrated plastic surgery fellowships. Everyone else has converted to integrated plastic surgery programs. And in the next upcoming few years, like urology is completely separate. You don't do gen surge and do urology here in the US. plastic surgery and vascular surgery are just going to remain integrated programs. Okay. So by the time you match and you graduate, you never know that you might not even have an opportunity to do that. Okay. So if that is your chosen branch through medical school, you feel like that is what you want to do, I think you should apply for that. Match rates are lower, but also remember less people apply. Okay. Um, but for any application, surgical specialty, I can speak for Gen Surge. In your mind, my personal mindset was like there's a 95% chance that I will go unmatched. That's a 95% chance. I knew that I was not going to match. Prelim, maybe, yes. And prelim to categorical, also, I knew 95% chance that I might not match. And I would cry about it. I was scared. I would get anxious. And my brother, I have a very supportive family. So my brother would say, what is the worst thing would happen? I was like, I will go unmatched. And he was like, so? I was like, so that's the end of the world. And he's like, no, that's not. You're still a physician. You will still get something else. You will still do something more in life. But 30, 40, 50 years down the line, what will you think? Yes, I tried. You will not have that, okay, I didn't put in an effort. And who cares? Like, in India, they're like, oh, graduate by 25, 26, 27, get married by 30. And my brother said, you want to get married now? I was like, no. He's like, you want children now? I was like, no. He's like, then just do whatever you're doing. Like, nobody's asking you to do anything else. Just try for what you want to be in life. And I was like, that's so wise. And I was like, fine, I'll just try. But people don't have family. People have like family issues and other things. Like they don't have support. Then you have to find your own support. And then you have to be your own person or like do whatever you want.
I'm sure you had a great family support, but by your experiences, I feel that you are yourself very inspiring and very resilient. I love that. So we have one last question, and I think it is a very apt last question. How this, how has this entire experience, this USMLE and the residency, changed you as a person?
I think entirely. I don't think so. I'm the same person as I was when I was in medical school. I hadn't cooked or cleaned or washed my clothes ever in my entire life. I think this experience makes you humble after you work 18 hours a day or do a 24-hour shift and you want to smash your face in the pillow at bed. You're like, nope, I have to give water to my plants. I have to cook something for myself. I'm a vegetarian, which is whatever. So, I have to come back home and be like, oh, Himani, you're broke, you're vegetarian, so just cook and then go to bed because otherwise you're going to wake up in 2 hours grumpy. So, I think this experience had made me more humble. And it also gives me the motivation that anything can be done. Anything and everything can be done. You just put your mind and soul to it. Um, but be ready for the failure. Be ready for the failure. I think that is one thing. Like I just had the support from my family that even if you fail, we are here for you. Okay. So mentally, I knew the worst thing is not matching, and I was okay with that. People get really stressed. This is not going to work out. This is not going to happen. I get stressed. I am very anxious. Okay. I'm a type A personality. I get very anxious. I'm like trying to do everything, and then still things don't work out. You crib, you cry, then you get over it and you get back to work. Okay. That's a cycle that will keep on going and you just become better at it. So I think the whole experience has completely transformed me. Just being a person who's lived in so many different cities here in the US, taken a bus and like try to navigate your way through things. In the first month of residency, I didn't have a car. So being in South Florida and not having a car, people cannot imagine what you can go through. And people will be like, oh, we're going here, we're going to do this. And I'm like, I'll walk. There are no footpaths at places because South Florida is huge. So you just navigating through these things, you become like, okay, Like, I still don't know how to get an eye checkup done. Like, I'm trying to figure out my eye insurance. I'm like second year. I just don't know like how to get it done. Like, I've never experienced like insurance and all these things. So it will make you humble, it will make you a nicer person. And like I think everyone, like you will, and then you will feel proud that, oh, I couldn't do this and now I can do this. So
And I'm sure it has changed you a lot personally, but do you also feel it has changed you a lot professionally, being in like from a med school to a resident?
yes, I think they say in medicine the hardest transition is from being a medical student like intern back home in India and then being a resident. I think that's the biggest transition that they say is in medicine. Then I think fellowship, you're like an attending, but people say when you become an attending, it's even a bigger transformation because then you don't have protective attendings behind you. Then it's your name, your legal everything. You do something really bad, then you lose your license. Your life work is gone and everything. Surgery is like very litigious here. Um, I think it's a huge transition coming from like writing everything on paper and then you coming here and using the EMR system. That is so different. Patient care is so different. Back home in India, you cannot order CT scans for everyone. Here, everyone gets CT scans, right? Like, so it's just like basic things. People back home cannot afford medications, but here you have like the first class medications that you can give, like we were talking about like adenexate alpha and like other drugs. Like people like give it here like candies and stuff. So it's so expensive, but you can like prescribe it here. So I think the whole experience makes you. I'm interested in global surgery, so makes you be more humble and like respect how medicine is practiced back home and how they practice medicine here. And then you eventually are going to be an amalgamation of all these things. So I think learning medicine there and here has made me grown as a physician a lot. But I don't forget my roots where I come from, and I will fight for a CT scan if it's unnecessary. So that's something that you have to know, and then you have to be sure on your clinical expertise. So I think that's what I feel has changed me.
It has been really nice to know all of that, Dr. Himani. Thank you so much. Your words have been very insightful, and
Thank
we got to know a lot about you, and we feel so good about it. So thank you so much for being here from everyone, from the entire team and all the participants.
thank you. I'm happy
Thank
to be here.
thank you so much.
All right.